Hello, everyone. Thank you for joining us today. Please keep in mind that anything discussed on the video is not financial, legal, nor tax advice. Please contact us individually to discuss any specific questions. Joining me today is independent Medicare specialist, Bill Sheriden. We will be reviewing some frequently asked questions regarding Medicare open enrollment, Medigap plans, Medicare Advantage, and much more. Bill, before we get into the questions, can you please share with us some details about your background and experience?
So I have a 25 years experience in healthcare. I've been licensed in health and life since 2007. And previous to that, I worked for hospitals and physician groups in positions of recruiting and referral development. So I'm well versed in the healthcare world, and I feel very comfortable in the Medicare space. I focus specifically on Medicare since 2014.
First question. I am turning 65, but I am still working. Do I have to enroll in Medicare?
The answer to that is no, they do not. As long as their employer benefits are as good as Medicare, they do not have to enroll in Medicare. Many people today do not retire at age 65. They continue to work sometimes into their early 70s. Once they decide to retire, though, they need to be sure that they pick the actual date when their benefits for the employer will end and the Medicare benefits will start. They have an 8-month period from the time that they decide to retire to enroll in Medicare. It's called a special enrollment period.
Next question. If I enroll in Medicare, how much of my medical expenses will I have to cover out of pocket?
Good question. So the original Medicare, which is A and B, covers about 80% of your healthcare expenses. You're responsible for the remaining 20%. And many people choose to fill that with what they call a Medigap plan. Medigap plan is exactly that. It fills in the gaps that Medicare does not cover. You're also usually required to have a Medicare Part D, which is a prescription plan. Most people have a prescription plan right now through their employer coverage, but once you leave your employer benefits, you'll need to choose a prescription plan. And I help people choose a Medigap plan and a prescription plan. I give them guidance on how to do that. And also I can enroll them in certain plans if they're ready to do that.
If I do not enroll in Medicare when I turn 65, can I enroll later? Is there a penalty?
When you turn 65, you have an initial enrollment period, and that is 3 months before you turn 65, the month of, and 3 months after you turn 65. You can enroll in Medicare. If you do not enroll at that time and you choose to enroll later and you do not have other health coverage, you may be issued a penalty. That penalty could be up to as much as 10% for every year you did not enroll in Medicare, and that penalty will stick with you for the rest of your life. So it's important to understand that you have to enroll in Medicare when you're first eligible. If you're collecting Social Security, you're going to be enrolled automatically. You'll receive a card in the mail. But if you're not, you need to speak to someone about, are my employer benefits is satisfactory to keep as long as I have them, and then when I retire, I can enroll in Medicare. So it's really important.
Does everyone pay the same premium for their Medicare coverage?
No, they do not. Medicare Part B premiums are determined by income. And what the IRS does or Medicare does is they look back at your 2 years previous tax records to determine what your premium will be. So for 2022, the premium was $170.10. But if you made more than a certain amount of money, either as a single filer or as a joint filer, your premium will increase depending upon the level of income you have. There is a table on Medicare.gov that lists the different income levels and what the premium would be for 2022. Now, this will change again for 2023, but they will not announce the changes until sometime in November. So it's important to understand how much you're going to pay just for your Part B. Again, this is for your Part B premium. This is not for a Medigap or a Part D. Well, Part D would also be affected, though. Part D is your prescription coverage. If you do make more money than the actual base premium, you will actually pay more for your Part D coverage as well. So it affects both Part B and Part D.
What is the difference between Medigap and Medicare Advantage?
The best way to think about Medigap and Medicare Advantage is Medigap fills in all the gaps that Medicare doesn't cover, original Medicare. Medicare Advantage is more like an HMO PPO plan, which many people have through their employer. Medigap coverage allows you to see any doctor anywhere in the country. There are no referrals required. With Medicare Advantage, you have a network of doctors. And if you go outside that network, you may have to be responsible yourself for paying the costs. Also, Medigap coverage many times has coverage that covers you when you travel outside the United States. Medicare Advantage coverage normally is just for within the United States. When you actually sign up for a Medigap policy, you have a 6-month open enrollment period where they do not ask any health questions and you are guaranteed to be issued a policy. So it's important when you choose to go into Medicare Part B, you need a Medigap policy that you need to enroll in the first 6 months to avoid health underwriting.
Can I use my HSA to pay for my Medicare premiums?
The answer is yes, you can pay for your Medicare Part B premium and your Medicare Part D premium with your HSA funds. You cannot use the HSA funds to pay for your Medigap premiums. Those are the rules. With many Medicare Advantage plans, they have copays and coinsurance. You can use your HSA to pay for some of those copays and coinsurance because many Medicare Advantage premiums do not actually have the zero premium. And so you pay as you use the system. So essentially, if you're admitted to a hospital or you see a doctor, there are copays and coinsurance. You can use your HSA funds to pay for those costs.
When is the open enrollment period for Medicare?
Every year, the annual enrollment period is October 15th until December 7th. This is a time when consumers who enroll in Medicare, if they have a Medicare Advantage plan, they can switch plans at that time. Or if they have a Medigap plan and a Part D plan, which is their prescription plan, they can also switch plans at that time. It is good to take a look at what you have currently to see if you need to make changes. Each plan that you have will send you a notification of change sometime in the month of September. And that notification of change will let you know if premiums have increased, if copays have increased. So it's good to talk to someone like myself, who's an advisor, to kind of give you an idea as to what your plan will look like the following year. Then you can make any changes during that period of October 15th until December 7th. That'll be effective on January 1st of the following year.
At what age should I first speak to a Medicare specialist?
You should probably talk sometime when you're 64 and you're thinking about whether or not you're going to enroll in Medicare. If you plan to continue working and your company has less than 20 employees, Medicare becomes your primary insurance at age 65. So it's smart to enroll in Medicare if the company you work for has less than 20 employees and you're receiving benefits from that company. If it's over 20 employees, the coverage you get from your employer will count as basically the same as Medicare. So you can use a special enrollment period later on to enroll.
What is the difference between Medicare Parts A, B, C, and D?
Medicare Part A, which is part of original Medicare, is your hospital coverage. It covers the time you spend in a hospital. Part B is your medical coverage, such as when you visit a doctor or you have outpatient surgery. Part C is what they call Medicare Advantage. It combines A and B into one plan. It guarantees all the same benefits of original Medicare, but it's actually administered by a private insurance company. That many of those plans also include Part D, which is your prescription coverage. So really, if it's A, B, and D are the three parts, and Part C is Medicare Advantage, which basically combines A, B, and D into one plan.
Bill, thank you again for your time. Thank you everyone for joining us today. And as always, we appreciate the confidence you have placed in our team. Please do not hesitate to reach out if you have any additional questions regarding your specific situation. Have a great day.
Thank you, Jackie. Look forward to helping your clients. Appreciate it.